Good day, everyone. So let's continue Module 8. This will be the last chapter for Module 8, which is Chapter 43, Caring for Older Persons, right? So, again, a lot of population of our elder persons. That's why we have like a lot of job opportunities for PSL for elderly care because, of course, people are living longer. Aging is the norm. That's our goal, like despite of their age or anything like that, we are there PSW to assist them to have the quality of life that they deserve, right? So future older adults, education, longer expectancy. So older workers play an increased role in the economy. So that's why a lot of PSWs nowadays are because we need a large number of supports for our number population of elderly people. So, under the caring for older persons, we have what we call the social cultural diversity and aging. Older adults today are more social culturally diverse. That means they are more diverse of the differences because of each and every one. They are more open to whatever changes and more possibility of trying things together despite of the cultural backgrounds. A smaller and more diverse family and active retirement. So even if after they retire they want to be still active, so a lot of like older people that we have now, they still attend to like day programs, any activities. They still, if they are like healthy, they want to be like at least promote independence. So that's one of our under the process of this, like providing or encouraging them to work independently if they can. So that's why. And gerontology, aging process, that gerontology, that's the aging process, while geriatrics are medicine for older. So these two things we should a little bit at least familiarize that what are the aging process and what are the medicine for older adults, right? So here comes like, of course, older adults, like sometimes they are a little bit like muscle are not that strong as usual. They might be a little bit weaker in terms of the physical strength, more like medications than the age. And is process, right? Aging is always a process. So respectful care and ageism. So how do we care for them? Overvalues youth, stereotypes for older persons. So there is a lot of stereotyping that we do. Oh, you cannot do that because you're old. Oh, you cannot go to this work because you're old. So far I haven't. I think in Canada we are so good in terms of accepting like age discrimination. That I think that's the right word I want to say, because if you can still able to work even if after retirement, then you are still allowed to work. There might be some other countries that when you reach retirement, you can no longer work because you're retired, or they have, let's say, age limits, right? But so far I believe in Canada, that we don't have the age, yes, we don't have age limit as long as you're capable of working. In terms of for older people, if we take care of them, we should always maintain their dignity, right? Respect their autonomy. Respect if they have if respect them in terms of making their own choices. Respect them if they want to give their opinion in terms of in terms of the care that you're going to do. And of course letting them know what are the things that you want to do with them, right? That's very simple, and maintaining the dignity that they deserve. And also for older people, there might be some multiple chronic conditions, and that's some we can say that's common. Maybe some of the elderly people that we will be taking care of in the future, they might have diabetes, at the same time hypertension, maybe like muscle pain, cholesterol, etc., etc. Right? So I'm not really sure what else more, but it could be like multiple chronic conditions. Under the emotional and social changes when they retire after retirement, it in fact it impacts their identity. Sometimes they're starting to like maybe a little bit of sad, especially if their children are so busy not visiting them, or maybe their income lowers because they only get the pension, not the usual thing that they will get when they were working, something like that. So it also affects the emotional and social changes. Mentioned there might be a loss in distance, that may lead them to isolation and loneliness because maybe their children have their own family and they seldom see their parents, right? So it's always good that if you have mothers and fathers that are old, like give time for them, like give time to at least see them once a week. That will boost and that will ease their loneliness, right? Feel that, oh, I have family, I have children. And sometimes too the children becomes caregiver if if the grandparents live with the if their mother live with them, or they live with their mother's home, right? And maybe their partners to become the caregiver. Depends who is stronger and who is, like, a little bit not sick compared to the other partner. So depression in older persons are also happening, not inevitable, but common due to major life changes, especially like if they used to be like very sociable, outgoing, and then suddenly because of old age, they start to like live on their own. They feel stagnant. They live in their own home. Nobody's, they can't do the things that they usually do when they were younger. Also, if they feel the loss, if they get sick, isolation also increase, right? Sometimes you often mistaken for normal aging signs, so that depression is a normal sign of aging. Technically, personally, I don't think so. It's a matter of like how how they live their life. So that's why, remember, on in Pace Foundation, our goal is to make sure that we are giving them the quality of life, not giving, but at least we are assisting them to achieve the quality of life after retirement, right? So possible, despite of the chronic conditions that they might have, at least they're still living their life. That's very important. So the physical changes, age gradual and varies between individuals, so that depends from one person to the other. It's not all the same together. Others include the diet. Some other like still eat a lot, or sometimes like lost their appetite, so they eat less. Exercise might decrease, depends on the client's condition. Stress, environment, and heredity. So the stress in the environment depends on the relationship with their family, loved ones, with their family and their loved ones, right? So quality of life does not need to decline. So that's the goal, right? So that's why we need to be there for them, encourage them to still be outgoing. We can be there for them to like encourage them to like go out. If they're living in the facility, then we can encourage them to mingle with the other clients, do activities with the social workers, lounge, have a conversation with the other clients, etc. Right? So those are the things that we can do. For the integumentary changes like the skin, at overview of what might be the changes for an elder person, right? So for the skin, it's of course it loses the elasticity. It could become dry and fragile. The hair becomes thin and brown spot appears. Sensation and increase the risk for injury for elder people. While their musculoskeletal changes, muscle mass decreases, as what we have mentioned. Joints stiffen, and the bones lost minerals. It could break easily, so that's why number one of the things that we need to make sure is their safety for our older people not to fall, because they are considered risk for fall because of the musculoskeletal changes. And of course, exercise helps preserve strength and mobility. Next, nervous system changes. It's lower the reflexes of the older people, reduced blood flow to brain, taste, smell, touch, and temperature sense. So they might gonna get too cold easily or too warm easily, depends. And their sleep patterns might change as well. So they might gonna like sleep less, like sleep. Sometimes they sleep late and then wake up very early, right? So those are some of the nervous system changes. While the circulatory and respiratory changes, the heart starts to weaken. Arteries, so there might be lung elasticity. Dyspnea possible. There's my possibility of dyspnea, or like difficulty of breathing. So they will get tired easily. They might gonna catch up their breath easily if they will have a severe exercise. So that's why it's always light exercise, right? And of course, the rest helps prevent exertion, right? So that's one thing. So they always need to have like siesta understandably in the afternoon, so there should be rest in between. So you should not let them do all activities all day, but you should encourage also rest in between. What else? So digestive and urinary changes. So it reduces saliva and digestive juices, so dysphagia risk. So there might be like difficulty of swallowing. Pulses movement will start to slow down as well, and chewing difficulties. So ideally for elderly people, we recommend like soft diet and diet that they can only take, right? Functions might decrease and bladder muscle weaken. So some of the elderly clients that we have, they start to have catheter or like that, or sometimes they are constipated. So there's some medication that's part of the routine that they take every day, like laxative, etc. Right? So that's part of it. While the reproductive changes and sexuality, men, slower erection response, less forceful orgasm. Women, these of course they menopause, with vaginal dryness and slower arousal. But again, sexuality remains important even for elderly people, so respect the needs. So let's say, for example, if they are one day you are cleaning and then you are doing your rounds and then suddenly you saw one client masturbating in his room, please do not stop them. What you can do is to leave them alone, close the door, and go back after, right? Go back maybe after a few minutes or so on checking on them, right? But then never open it up to them like, oh, Mr. Smith, I saw you earlier masturbating, so that's why I didn't interrupt. No. So keep it private as if like you didn't see anything, but of course you document that and report your supervisor. But to him you should not open a conversation about sexual acts or something like that. To remain the privacy and of course their dignity, right? So again, it's still important. All right, so that's it for about elderly care. Caring for older person, chapter 43. It's still in the Elsevier 2022. So that's it for today, guys, and that's it for module 8. So on our next meeting, we will be talking about module 9. So it's the palliative care, right? Caring for clients who are dying or dying clients. All right, have a good day, everyone. Take care.